My name is Roxana in representation of the International Federation on Aging, the IFA, to discuss hearing in later life today. So on to the next slide, please. To get started, the IFA's vision is really of a world of healthy older people who are both respected as well as protected, and that really underpins all that we say and we do in the decade of healthy aging. The Decade of Healthy Aging, it is a global initiative to improve the lives of older people, their families, their communities, by promoting health, by promoting inclusion and dignity as people age. It brings together really a diverse group, government, civil society, and others to take just action on aging-related issues worldwide. And the decade, just still on the previous slide, I'm sorry. And the decade has four action areas, and it includes combating ageism, age-friendly environments, integrated care, and long-term care. And this is all underpinned by a rights-based approach to healthy aging. And complementary to this, there's also four enablers to shift the status quo amongst the areas for actions that were just mentioned. So this includes voice and meaningful engagement, leadership and capacity building, connecting stakeholders, and also, of course, strengthening data, research, and innovations. Now, at the IFA, we continue to be a leader in the field by making and strengthening these connections across disciplines and across sectors towards this common policy agenda and towards the development of a new narrative about the impact of intrinsic and external factors on the functional ability of older people, including, of course, hearing health in later life. Now, on the next slide, as a little bit of a background, and as reported by the WHO report on aging, on hearing, globally, more than 1.5 billion people experience some degree of hearing loss, and this translates to about 1 in 5, which is a lot. By 2050, this number is anticipated to grow to 2.5 billion, which really means 1 in 4 people experiencing some degree of hearing complications. Now, in parallel to this is also the growing aging population. So by 2050, the projected number of persons 60 and older will double to 2.1 billion, and the number of 80 years and older is expected to triple to reach an estimated 426 million individuals. Now, this rapidly, aging global population with over 65% of persons older than 60 experiencing some degree of hearing loss, it places the importance of integrated hearing health into health systems transformation so high on governmental agendas and in the UN Decade of Healthy Aging. Now, additionally, and still on the previous slide, I'm so sorry. Additionally, in addition to this rapidly aging global population, many published studies, such as some on the screen here today, so from, the Journal of the American Medical Association, the NIA, the Lancet, Johns Hopkins, just to name a few, have also demonstrated the strong link between dementia and hearing. And it's been found that older adults with greater severity of hearing loss were also more likely to have dementia, but the likelihood of dementia was lower among hearing aid users compared to non-users. So the link between hearing loss and dementia, it builds support for public health action to improve hearing care access with this growing evidence, IFA has really committed to hearing health as a core aspect of our focus. So on the next slide, as we consider, the high prevalence and substantial societal implications that are associated with hearing loss in older adults, understanding barriers really is quite key to improving the quality of life of people. So hearing loss is set against the backdrop of so many different health issues. This, physically. Hearing connects to physical health issues that affect function, such as hearing increasing risks of falls. Psychological. Hearing connects to psychological changes, dementia and depression being one of them. And then socially, noise acts as an environmental challenge that can create a pathway for people to withdraw from, leading to social isolation. Now, despite the growing evidence of the link between hearing health in the broader framework of healthy aging, there are also many barriers to ear and hearing care, and this can include high cost of hearing care, stigma, which is also related to ageism, lack of awareness and information, as well as structural barriers such as transportation, difficulty in getting to a clinic, and the challenge of hearing care delivery system pathways. Now, the lack of awareness of prioritization by governments, policymakers, healthcare providers in conjunction with hearing-related stigma and many choosing not to seek professional advice together creates a large barrier to the treatment of hearing loss or anyone impacted. Additionally, one prominent gap is the need for aging organizations, aging experts, and hearing experts to really join forces and work together to foster interprofessional and interdisciplinary collaboration to move the need for integration of aging and hearing health continuously forward. Now, with that, on the next slide, we can also look at some of the context of these gaps and barriers to seeking hearing care. So making connections across intergovernmental policy agendas becomes very important from a policy perspective. So when we call for improved ear and hearing care infrastructure, greater investment, it includes a variety of things, including greater investment in ear and hearing care health promotion. Hearing in later life presents such a great opportunity to not only actively support, but exercise each of the enablers and the action areas that we mentioned earlier on of the decade of healthy aging. So the decade, it highlights the importance of collaboration actions to improve the lives of older people for healthy aging. And by virtue of hearing being positioned as an outcome of healthy aging, the provision of integrated care aligning with WHO's guidance on ICOPE, integrated care for older persons, it's actually on the top on the screen here. It becomes so central to the narrative of desired outcomes of healthy aging. But despite this, there's also so many other intergovernmental agendas that don't really mention the importance of hearing health in later life. So just a few examples. The framework for long-term care, it only slightly touches on the need to address improving communication barriers in long-term care for people with hearing or vision impairment. Similarly, despite the report on ageism outlining a framework for actions to reduce ageism, it doesn't really touch at all on hearing, despite ageism also being tied to hearing-related stigma. So really over here, what I'm trying to get at is when we consolidate, the decade of healthy aging, its action areas, the WHO guidelines on integrated care for older persons, and the World Report on Hearing, it's important that we take into consideration the prioritization of person-centered integrated care, and again, think about the urgent requirement of interdisciplinary engagement amongst all intergovernmental agendas. But on the next slide, and I'll perhaps finish it off on this slide as well. I think what I'm trying, the real core of the message today is hearing loss, particularly with age. It's about the person, it's about their value, it's about their identity, their productivity, and their place in society. So as part of that, solutions, including all of these various pieces, the decade of healthy aging and so forth, should be catered to person-specific needs with the dignity and the value of the person at the forefront of all care services. So thank you very much, everyone, for your time and for your attention. And I'll